I'm Cynthia. I'm 49 years old, and I've been seeing Dr. Henry for about 8 months. I found Dr. Henry by another doctor I was seeing in the office, and I was ready to go in for surgery, and I was trying to find another way to heal my body without the means of surgery. I had an accident in the ocean, ripping open my dura, which is a membrane around my spine, from my neck down to my middle of my back. It's called a CSF leak, and I was trying to get it to heal. That's where the surgery was going to come in. They were going to have to sew it up. And so I met Dr. Henry, and Dr. Henry explained to me that she had some ideas, and so that's how come I started seeing her. Most doctors don't even understand what a CSF leak is, and Dr. Henry knew immediately. The symptoms were headache, major headache, and lightness of the head, and couldn't think, couldn't look straight, it was very hard to function. Dr. Henry knew pretty quickly what she was going to do. It seemed to me, at least, that the frequency-based microcurrents were going to reach the membrane at its deeper level. So she started that with me immediately. And the first treatment, I didn't know anything about it, and I had just come from MRIs, and I was kind of a wreck already, and came in, and she just spent a lot of time with me and calmed me down and put me on the machine and ran the frequencies just to calm me, I think, to start with. And then also to start the healing of my dura. It's been about 8 months, and we've come a long, long way. And besides the leak, it's almost an onion peeling away, because there were other things that Dr. Henry found that was causing some of my head pain. It wasn't just my dura leak. I had some sugar issues, and she talked to me a lot about foods, what to eat, what not to eat, how to eat it. And for me, I learned that oil and protein were very important. And then my adrenal glands were another layer that were causing some of my headache. And then also we found out that I was allergic to caffeine. And after I got off the caffeine, and Dr. Henry calls it the caffeine confusion, that's also when she was able to really analyze what was going on. And so Dr. Henry put me on a B5, B6, and I think it's prednisolone or pregnenolone or something like that to help me out. So it was a layer of things that were causing my head to hurt, not just my leak. I think if I had done the surgery, I would have taken care of part of it and not all of it. Even then, I don't know if it would have returned. Before I started coming, I couldn't exercise at all. All my energy was trying to heal. And through the treatments with Dr. Henry, I've been able to start walking and swimming and exercising, which also helps my sugar. I was trying to run my daily life in a lot of pain. Now I can run my daily life at a different level of comfort. I have hope.